Hi, welcome to the Refugee Welcome Collective Lunch and Learn series. In these sessions, we aim to bring interesting and timely information to you, supporters of refugees. Whether you're a volunteer, community sponsor, resettlement agency staff, a local advocate, or just someone who's interested in learning more, we hope that you enjoy today's session. Please go to the next slide. Technical deep dive, co-sponsorship, and core services. Refugee Welcome Collective collaborates with partners to provide in-depth training programs, weekly learning sessions, resources, and on-demand technical assistance for sponsors, practitioners at resettlement agencies, refugees paired with sponsors, community and institutional partners, and others to support quality community sponsorship programs across the United States. Go to the next slide, please. As a reminder for everyone joining the call today, there's a control panel in your upper right-hand corner that will allow you to submit questions through the questions box, not the chat, the questions box, please. There will be ample time at the end of the webinar for questions and answers. Everyone on today's webinar is automatically muted. However, if you have any technical issues, please raise your hand through the control panel or submit a question in the questions box so we can assist you. Additionally, the presentation, any resources, and a recording will be sent to everyone following today's webinar. This brings us to our presenters for today. Please go to the next slide. Our presenters are myself, Derek Feldman, Senior Community Sponsorship Technical Assistance Associate at Refugee Welcome Collective, Sarah Coldstone, Community Sponsorship Coordinator at Delegation, Barb Davis, Community Sponsorship Developer at IRIS, also known as Integrated Refugee and Immigrant Services, and Cindy Dunn, Community Sponsorship Associate as well at IRIS. You can go ahead and go to the next slide, please. So today's focus is that deep dive on community sponsorship and specifically some core services. So first, wanted to highlight the definition of a co-sponsor. Based on the cooperative agreement, a community group that has accepted in a non-legally binding written agreement with a local affiliate the responsibility to provide or ensure the provision of the majority or even all of the R&P services in partnership with the local affiliate. This is different just in terms of definition to a support team who still provides those same types of core services, but doesn't reach that minimum requirement, again, just in terms of definition of the majority of R&P services. So support teams are extremely important and very valuable to affiliate offices, to the work that they do for refugees. But it's just in terms of a definition of what meets that standard of majority of core services for R&P services for clients. Go ahead and go to the next slide, please. Core services can sort of be thought of in terms of the three different time frames in which those core services take place: pre-arrival, reception, those that are done at that day of arrival, and then service over the service period, over that 90-day service period. What is a core service? A service or support that a refugee client has a right to during the reception and placement or R&P service period, during that 90 days after arrival, outlined by the State Department, by the PRM in the cooperative agreement. The cooperative agreement indicates the required services, which ones are delegable, which ones can be delegated to community groups and volunteers, which ones must be done in active collaboration with affiliate staff, which ones can't be delegated, but it does not provide an official count per se. Go ahead to the next slide. Some examples of those core services. There are a few pre-arrival ones that just aren't able to be delegated, outlined in the cooperative agreement. And those are things that make sense that they're not delegated, things like assuring a case, things like training for the co-sponsor group. Obviously, the co-sponsor group can't train themselves, so that's those are things that can't just be delegated to a co-sponsor or volunteer. Some of those core services that can be delegated are: one, securing decent, safe, and sanitary housing. Many co-sponsor groups have housing available, either at the parsonage or someone in the group has a property that they lease, or someone, and we're able to donate that property. Additionally, or maybe they've just, helped the affiliate staff by reaching out to local landlords themselves and to establish that housing. Another one is providing the furniture and household items. Obviously, a very popular core service that groups tend to do. Donating beds and couches and all of the things that a family would need upon arrival. Go ahead to the next one. Some other examples of core services during the reception. So again, another very popular one is meeting at the airport with appropriate interpretation and transporting the family to their fully furnished living quarters. Another one, provide food or food allowance for a hot, culturally appropriate meal. Again, their clients have a right to that hot, culturally appropriate meal when they first arrive, and co-sponsors, support teams, and volunteers can provide that. They can also provide groceries to clients so that they can prepare their own meals upon arrival and until they have receipt of SNAP benefits or employment where they can pay for those services themselves. They can provide seasonally appropriate clothes for work, school, everyday use. And another one that the cooperative agreement allows to be delegated is providing appropriate amount of pocket money for each adult. There's nothing in the cooperative agreement that prevents them from providing that pocket money. However, I have a star there next to it because honestly, it is likely not delegated. It can be, but this is one that a lot of affiliate offices, because there's cash involved, usually reserve that for their own staff to be able to do that. So just so people are aware of that. Go ahead to the next slide. Some of the other ones that are outlined in the cooperative agreement that are not able to be delegated: one, for Class A health conditions. So these are clients that have significant health concerns, that can't just be delegated to the group. Staff members have to be involved in that process. Same with communicating with state and local welfare authorities for special cases and things like that. What can be delegated but not fully delegated, it can be done in active collaboration with affiliate staff, is develop and implement a resettlement service plan and the assistance with access to health services. So just so sort of, generally people are aware of that. We'll go to the next one. Great. Some core services that can be delegated according to the cooperative agreement. The intake interview, although I put a star next to that one because that one too, while there's nothing in the cooperative agreement that prevents it from being delegated, this is one, because it tends to be very paperwork and policy sort of specific, that this one tends to be utilized by staff and less so, but it certainly is possible with proper training and that kind of thing. The home visits, there are 2 required home visits: the next day home visit and the 30-day home visit. It's also an additional home visit is required if a refugee moves from temporary to permanent housing during that 90-day R&P period. So these are other possible core services that can be done by a community-sponsored group. Applications for Social Security card. My colleague Jessica Ashcraft in discussions, we discussed the fact that we know that they're sort of moving towards doing applications overseas before a refugee arrives. So at some point that might be different or might not be fully included, although perhaps there's room for a community group to follow up to make sure that, because things happen, names are spelled wrong, maybe it got lost in the mail, all kinds of things like that. Sometimes it requires follow-up. So, but for now, that's still the case. And then applications and every state is different. So this is another kind of area. Applications for cash assistance, for medical assistance like Medicaid, for SNAP benefits, or what's commonly called food stamps, or any other additional enrollments and other public benefits as applicable, if for WIC or for Social Security disability, things like that. Go to the next one. And some other core services that can be delegated according to the cooperative agreement: enrollment in English language programming, enrollment in employment services, enrollment in school, obviously really important for school-age children. I have those three asterisks and sort of as the key, just to say basically as applicable, because if a family of 2 adults that have no children, obviously the school enrollment wouldn't be required for them because they have no school-age children. Same with registering for selective service. If no member of the family is a male between the ages of 18 and 25, obviously that's not one that would be required. Number 13, filing the AR-11, change of address form within 10 days of move, completing and filing affidavits of relationship, provide transportation in compliance with local motor safety laws, provide transportation to job interviews and job training. Obviously, I'd also just make a point for just learning public transportation. I think that's really included as part of transportation for sure. And then providing cultural orientation with it's laid out specifics about what that actually entails. Go ahead to the next slide. So what does the majority of services mean? How many core services are there? Essentially, there are 15 fully delegable services, but I want to highlight the fact that there is some gray area around the margins, and I'll talk about these questions that sort of have come up. And so therefore, it means that 8 is kind of the agreed upon number that would be the majority of services through the community sponsorship working group and with coordination with all 9 RAs who have put some input in that. But there still are some questions or some sort of gray areas there. For example, and here are some specific ones: the airport arrival and the transportation to furnished living quarters. Is that 1 or is that 2? Are those 2 separate, or is that just 1? How about providing a welcome meal versus providing groceries? Is that just 1? Is that all the same, or are they 2 separate services, core services? There's certainly 2 different jobs that would need to be done. Are the 2 required home visits the next day and the 30-day? Is that considered just 1 home visits, or are they 2 separate services? Again, what about possible additional home visit if moving from a temporary to permanent housing during the RDP period? Are applications for cash assistance, Medicaid, SNAP, is that all 1 service, or are they 3 different services? What about additional benefits? You can see kind of where some of this gray area or some of the questions kind of arise. How do we count enrollment in school for families that don't have children that are school age? How do we count registering for selective service if only for those families that have a male age 18 to 25? Again, same with affidavits of relationship and providing transportation. Is this 1 or 2 different services? And then there's the whole kind of question of what is exactly delegable versus inactive collaboration with staff. Do we count those or do we not count those? So that's just the general. We are working on clarifying those and kind of working from all 9 RAs a working definition and clarity on those so that we can provide that technical assistance. But some of this, I think it's okay to have a little bit of that gray area that allows people to interpret. No one is going to suggest that if you just do 1 core service that is fair enough to call them a co-sponsor group where they're providing a majority of services. So just want to kind of, but as we get close to that number 8, maybe there's a little bit of room. So, so I'm going to go ahead and stop there for myself, and I'd like to move to one of our presenters, Sarah Colstow at Delegation. Sarah, could you introduce yourself and kind of the co-sponsorship program that you coordinate at Delegation?
Sure. Thanks, Derek. It's really good to be here with you all. My name is Sarah, like Derek mentioned, and I'm from Delegation. We are a refugee resettlement organization in Kansas City, Missouri. And so I was hired as the co-sponsorship coordinator to kind of get this program off the ground. So I've only been here about 6 months. And we, had our ideal scenario kind of set up, and then Afghanistan hit. And so kind of shuffled things around a bit. But yeah, we've developed the program it's been in development for about 1.5 years, even before I was hired. And then we kicked it off. I guess we had our first 2 co-sponsorship teams in January, I think, or maybe December. It might've been December that we kind of, set forth and made our first 2 matches. And now we have about 8 or 9 teams that are working alongside families. So, yeah.
Excellent. And how do you at Delegation talk about core services, and how do you determine which ones you want to keep in-house for staff, or which ones you feel comfortable delegating to community sponsored groups or support?
Sure. I think big picture for us, we were looking at, well, we used a lot of the IRIS model, and I think long-term it would be awesome to delegate everything and have, co-sponsor teams that are set up. But knowing that this was something that we were kind of baby stepping toward, we looked at the big picture and said, okay, what are things that people who've basically grown up in the US have navigated systems, government systems, paperwork, what are things that they could easily assume, and it wouldn't be a ton of work to kind of hand that over to them. I think that's kind of how we looked at it. So, the things that we've handed over were a lot of the paperwork stuff, the Social Security, the food stamps, and then things like enrolling the kids in school. I mean, if you have school-age children, you've navigated those systems before. So it's a lot of things we thought, well, our co-sponsors are already going to be familiar with this. It's not going to be a ton of training to teach them how to do this. That's kind of, I would say, a broad overview of how we looked at what core services we were going to assign to our groups.
Did you, during the course, as you were sort of, I wouldn't say piloting this program, but as you were sort of rolling it out, were there sort of lessons learned in terms of which ones you thought ahead of time might be easy, or might be easy for community sponsors to provide, but then found that they were more difficult than they realized, or vice versa? Were there things that you thought maybe were going to be too complicated or too difficult for people to do, but then you realized, no, actually with a little bit of training and a little bit of support, they were able to do some of those?
Yeah, that's a good question. I feel like we didn't want to withhold starting the program off because of Afghanistan, but because of that, there are things that we had assigned to groups that they haven't yet done. So things like, while we had all of the Afghans in temporary housing, we did a lot of the paperwork stuff, the food stamp applications, so the Social Security. So we haven't actually gone through a whole process with a group doing what we assigned to them, because a lot of that stuff was already done. I will say, I think there's things that we held back that I want to train up co-sponsors to do, like the first day home visit. We withheld that, and we have our case managers continuing to do that, but that's one I think with training would be a perfect one for the co-sponsors to take over. So just kind of evaluating how things have gone up to this point and recognizing we haven't been working in an ideal situation. So I'm excited to kind of have a slower pace, hopefully now, with some of our groups, to get some groups trained up and kind of walk through the whole process that we haven't been able to walk through yet. Yeah.
That's great. And how would you describe that process of working between case manager, caseworker, and that community sponsored group? How did that how did that process go in terms of training staff to be able to work with a co-sponsor group? Or, you know, once you introduce them to each other, you know, what kinds of issues came up, or how, you know, how have you worked through that process?
Yeah, I think one of the maybe biggest issues we've had is the communication of some of our volunteers have wanted direct communication with the case managers. Like, well, you know, they kind of fought against going through me, and I said, no, I'm that person. And then we've even had some case managers who've said, well, it would just be easier if you put me in touch with the volunteer. And what I'm trying to say is actually it wouldn't, because you don't know what it's like to work with this many volunteers. And it's going to be an added burden to you. So I think we're still in the process of kind of formalizing our communication channels a little bit better with some of our case managers who maybe they want more of control, or they think they want it, but they don't know what they're asking for. Because, you know, as you know, that some volunteers are a little, you need to hold their hand a little bit more than some of them who are just, you can release them and they go for it. So that's been an issue. It's also, I think just getting some of our case managers on board in general with this whole idea has been a process. But I will say one of the things that this situation, particularly with our Afghan clients, has shown is that our community sponsorship teams have been really indispensable. Like, they have provided great services to the clients that they've worked with, and they've really been able to expedite some of the things that our case managers haven't been able to do because they've been so inundated. So I think even though it wasn't an ideal way to start our program and to kind of, you know, do the whole initiating with new groups, I think it's been great because it's really shown our case managers, hey, this is an asset to me as a case manager, and it is an asset to our clients. And that's what we've wanted all along, is for this to be an asset to everybody involved, not just the volunteers, but the client as well as Delegation. So I think we're seeing that now.
Yeah, that's wonderful. Anything else, or any sort of final thoughts or things that you would like to share about your experience at Delegation with community sponsorship? And again, we'll have some time at the end here for some questions and answers from the audience, but just wanted to see if there was any additional thing that we haven't covered that you'd like to share.
I don't know. I feel like still not quite an expert at this, because like I said, this for us, I know for everyone, it's a new program. But again, really excited to have some time to do it from the top down, like when we have our plan, you know, so now hopefully we can actually initiate our plan as we intended with things slowing down a bit. But yeah, that's it.
Awesome. Thank you so much, Sarah. Really appreciate your insight and your experience in this. I'd like to go ahead now and turn to Iris, to Barb and Cindy, who are here. Barb is having just a little bit of technical difficulty with her webcam, but she is here in audio form, and Cindy is here as well. So I'll go ahead and let you guys take it away.
Hi, thank you. Thank you, Derek. Iris appreciates the invitation to this conversation. And Iris is a co-sponsor agency that has been around since the 80s, but they actually implemented a co-sponsorship model in response to the Syrian refugee crisis back in 2015. That's when I became involved with it, but not as an employee of Iris, but as a co-sponsor group leader who responded to that call for community groups to help welcome refugee families into their communities. So the group that I help lead has worked with 3 refugee families. The first was from Syria back in 2016, then a family from Colombia, and now we are working with an Afghan family. And based on that experience, Iris hired me as a sponsorship developer, which means I help new groups that are forming across Connecticut to get organized and to be led through that application process before they are greenlit, we call it at Iris, and asked to help resettle a family within their community. So we're going to be talking about the delegation of core services as Iris asks co-sponsor groups to take care of, and we can go to the next slide. So the delegation of core services, Derek already went over many of them, and for IRIS, which is Integrated Refugee and Immigrant Services, all of the services that were outlined as being something that either the co-sponsor group could take care of or they could do it in collaboration, we delegate 100% of those services to the co-sponsor group. So the way it works at IRIS is there are several case managers, and every case manager is assigned to a family, and if a family is assigned to a co-sponsor group, then that case manager is the contact with the co-sponsor group. And to your point, Sarah, the way IRIS makes sure that that works okay is the co-sponsor groups are told that there should be one person who is a point person with the case manager. And so there should never be any other volunteers reaching out to that case manager directly. It should always go through that one point person. The case manager does take care of those initial client intake interviews, including the employment interview, and some of those first forms, but then very quickly everything is delegated to co-sponsor groups. And I'm sure most of you are familiar with the basic structure that co-sponsor groups get broken down into, with the different teams taking care of all of the different services that need to be implemented. So the housing, employment, education, transportation, all of it, covers every single task that needs to be accomplished with a family. And several of those teams are also broken into several sub-teams. So IRIS is very careful about making sure that groups are prepared with the proper amount of volunteers and the proper kinds of expertise that the volunteers represent and whatnot. And they accomplish that through training and through that the job that both Cindy and I do, which is that co-sponsorship developer job, to make sure that those teams are filled out appropriately. But the group also has to understand, if it's going to be successful, that not only should those resettlement teams be well filled out, but they have to be able to manage their group efficiently. They have to have volunteers that are dedicated to onboarding new volunteers, into handling how the group communicates, documentation storage. IRIS requires a lot of training at this point from all volunteers, as well as copies of driver's licenses and all kinds of documents that need to be stored. So if a group is not prepared to handle those tasks, then the resettlement tasks become harder to cover. Things like fundraising obviously need to be handled. So those groups, all of those different tasks are the co-sponsorship developer helps guide groups into making sure they're ready in all of those areas so they are able to efficiently handle all of those resettlement tasks. And the case manager's role throughout all of that is, after a group is greenlit and they've said that they are ready to accept a family, and the co-sponsorship developer agrees and approves their application, then a case manager starts working with them once a family is assigned. That case manager offers guidance, support, but also requires accountability from all of those tasks. Sometimes just in the form of all those forms that needed to be handed back in, but sometimes in other ways as well. Okay, next slide, I think. So in order to make sure that the co-sponsor group does achieve success, the things that IRIS has found over the last several years that work really well is to make sure that there is a robust application process, which requires the co-sponsor group to complete an in-depth community research, and then also receives feedback about that research from a co-sponsorship developer. So IRIS's application, it requires very specific information get included about the community resources that the group has investigated. That's everything from ESOL classes in the community to what the enrollment is like with the local public schools, to what the public transportation system includes, what the different limitations are of that public transportation system are, everything that they've sourced enough interpreters, who exactly they talk to. And throughout that application process, if there are questions or concerns that arise, then the co-sponsorship developer helps them figure out those issues. In addition to that, as they're getting their application together, every single volunteer that is involved with resettling a family has comprehensive training, which is provided by IRIS. It's 6 hours of training broken into 3 2-hour sessions, and it covers all of those resettlement group tasks. And it also includes information on cultural orientation, on important issues that come up with boundaries between families and IRIS and the co-sponsor group. And it gets pretty in depth. And IRIS feels very strongly that all volunteers should participate in that training, so that all volunteers are on the same page with all of those very important, especially boundary training issues, to make sure that a driver or a tutor or someone helping to register them with DSS, the Department of Social Services, for their SNAP benefits or whatever, that they all understand exactly how they're going to help the family move towards self-sufficiency, which is the ultimate goal and what IRIS emphasizes. Now, also, it's important that the group has a solid organizational structure and that there are clear lines of communication. And it seems pretty obvious to say that volunteers should always communicate directly with their team leader. So if you're a member of education, if you have questions or concerns or ideas, it's brought to your team leader. The team leader also would bring anything that can't be resolved within that team to the co-sponsor group leader. And IRIS recommends that there be 2 group leaders that basically act as project managers to oversee that everything is being accomplished. That's part of the accountability piece, to make sure all tasks can be handled efficiently. And then if there are questions beyond that, it goes directly to the IRIS case manager, who can answer whatever comes up about the different resettlement areas. Now, as I said earlier, these last 2 points are really important for a successful co-sponsor group. They really need to have a really deep volunteer base with lots of different expertise and experience represented. So on your healthcare team, the group that I help lead, we have found the best volunteers are retired nurses, somebody who really knows the ins and outs of whatever you need to get accomplished for healthcare. Education, obviously teachers who are either retired or still teaching are huge helps, and even just parents, people who have registered their kids in school, know how to navigate that system. Also mental health, people with mental health expertise and how to connect clients with the appropriate services. And throughout that application process, the co-sponsorship developer is really trying to ensure that all of those areas are filled out within a group. And the appropriate number of volunteers. One of the biggest mistakes a group can make is to not have enough, because then too many tasks fall to too few people and they get burned out, which obviously is something you need to avoid. So with all of that, the biggest points to take away is that with the proper training and support from the affiliate, IRIS absolutely believes that 100% of those services can be delegated to co-sponsor groups pretty efficiently. And with that, I'm going to introduce my colleague, Cindy Dunn, also from IRIS, who will continue with our presentation.
Hi there, thanks Barb. I basically have the same resume as Barb. I am not only a community co-sponsorship developer for IRIS, but I am also a co-leader of a community co-sponsorship group in my hometown of Newtown, Connecticut. We've resettled 3 families over the past few years, and we are awaiting a match with a 4th family in the near future. So We thought we would share with you some of the most common resettlement challenges that our co-sponsor groups experience, and what we do at IRIS to be proactive about this. And Barb touched on many of the points in her presentation. We want to make sure that our groups can overcome some of the difficulties they might encounter when delivering their core services. So one of the more general challenges is that group problem solving and communication within the groups, because community co-sponsorship is a group of people that are interfacing with the client. So it's really important to have everyone, understand the goals and procedures of the program and know how and when to communicate issues. And so one of the tools that we use at IRIS is our co-sponsor training. We require all volunteers, as Barb said, to attend, so everyone has the same message. During that training, we talk in depth about conflicts. We give scenarios of real life issues that groups might have experienced, and this gives the groups ideas of the types of things they might need to work through during their resettlement process. In addition to the training at IRIS, we have our co-sponsorship developers like Barb and myself that are available to help the developing groups. We can answer questions. We can hold, we hold smaller Zoom meetings for topics that they find difficult. But more importantly, we get to know the group and its leaders a bit, and we can sort of along the way determine whether this group understands the commitment and understands the flexibility that's needed to do this work. We can figure out if their leadership is working or not working. And we also can get a sense of whether how they feel about the unknowns of co-sponsorship, because we give them so little information about their families before they get here. And so another common challenge is the forms associated with resettlement. This can be a little bit daunting to new groups. So at IRIS, during our co-sponsorship training, we drive this point home that co-sponsorship is not a casual relationship, but there is a federal contract involved, and these forms should be viewed as a good practice, because the government is holding our agencies accountable, and we make sure that there's parity in the process. Additionally, we provide guidance through our online manual and various instructions and checklists on our website, and sometimes we'll hold quick training sessions to alleviate any uncertainty in groups that are worried about how and when to submit forms. We also require each group to have a volunteer dedicated to the task of handing in forms in appropriate timelines, so that this task does not get lost among the various duties and committees. Another issue that is more recently a problem is housing. This housing crisis that we're experiencing across the country not only affects our co-sponsors' ability to find housing for our new arrivals, but we're also finding that the higher prices in some areas of the initial resettlement town are not sustainable for the families at the end of the sponsorship period. So to prepare our co-sponsor groups for this, as part of our application process, as Barb had mentioned, we require that the co-sponsors learn their housing market and explain to us what they have learned. What are the costs and availabilities of 1, 2, 3 bedroom apartments? How competitive is it? So that they know what they're getting into. Additionally, at our training and through our online resources, we make sure that co-sponsors understand the IRIS rental assistance policy so that they know what their financial obligation is. It's not a surprise. And they will proactively think about helping their family possibly find new affordable housing when their rental or when their resettlement period is done. We've also increased the amount of funds that co-sponsors must raise because of the increase in housing prices. And actually nobody so far is complaining about that. It seems that it's easy to raise money in Connecticut, so that's a good thing. Another challenging issue, I think you can go to the next slide, for co-sponsor groups occurs when they receive clients that are pre-literate and have no English. So that combination is a tough combination, and it affects so many areas of services. It affects their employment, their driving, their ability to make appointments on their own, to communicate with their children's schools. and it just can cause a lot of delays. So to help our co-sponsors deal with this, during our IRIS training, again, we talk about being prepared for the most challenging case scenarios. It's wonderful if you receive a family that speaks English and has a college degree, but that doesn't generally happen. And so our co-sponsors are encouraged to find expert volunteers to the best of their abilities in their communities with strong literacy and language experience for tutoring. And also, we encourage them to be thoughtful when looking for formal English classes for a client who is pre-literate, because that type of class might look a little bit different for clients that cannot read and write. And they also must prepare to do more tutoring in that case. So another topic that can be very challenging is when there are serious issues with health and mental health. This can affect employment and their time to self-sufficiency. And so to help our co-sponsor groups prepare for this as part of our application process, we require that groups make connections early to providers and services in their community. Of course, making sure the providers accept Medicare and are accepting new patients. We also require that groups have a mental health emergency plan in place that lets all of their volunteers know what to do if they see mental health issues and there is an emergency. They should know who to call, who to call in their group, who to call, where are the closest emergency rooms, things like that. And also that the case manager must be involved in this type of situation. And that was the last part of the support for health and mental health, is that the case manager is involved and can provide guidance and share their experience and let the group know their obligation in this situation and also what their boundaries are. And so the last topic we wanted to leave you with is the idea of the unanticipated challenges that we face. Those situations that you can't foresee or prepare for, like a pandemic or a crisis that throws new rules and faster response of co-sponsor groups, like the Afghan crisis. And just a note that our community co-sponsor groups in Connecticut that are affiliated with IRIS have resettled approximately a third of the over 400 Afghans that came through IRIS this past fall. So it's a pretty significant number. And I can tell you from my own experience as a co-sponsor leader in my own community, we resettled a family during the pandemic. Our third family arrived in March of 2020, just as the US was closing its doors to refugees. And this resettlement was really the mother of all challenges for our co-sponsor group. Every aspect of delivering services had an added obstacle, and we had probably 3/4 of our volunteers just drop out because of health or because of being scared or whatever. I mean, it was a crazy time. But we were able to deliver on all of the core services, of course, in a bit of an extended timeline, but we were successful. And I really credit that success to IRIS training. I was not working for IRIS at the time, but they really prepared us to be flexible and to not depend on IRIS as much as to depend on our community resources. And additionally, the support and guidance from IRIS case managers who kept us informed about policy changes, timeline changes, things that we needed to know about. So Barb and I strongly believe, and we at IRIS strongly believe, that through proper training and help from case management guidance, that we can, community groups can do full delegation of core services, and we can do it really well. And that's it.
Awesome, thank you so much, Cindy and Barb and Sarah. We're going to go ahead to the question and answer, and we'll probably go a little bit later than we usually do, because this was a lot of information, and we really appreciate everyone here listening. There's still some time to put the question in the questions box. It looks like I kind of looked up, and it looked like someone was having some technical problems with hearing, but I'm assuming that everyone else is okay hearing us. If not, you actually will receive a video link to this so you can watch it later. But one of the questions I think was, what's the relationship between local nonprofits and where some refugees are from? So I don't know if anyone wants to take that. I can just say that, if you're, familiar with, refugee resettlement in general, that most refugees, not all, are connected with a U.S. tie, and so there is a community usually there in the place that someone is being resettled, and so there certainly are lots of opportunities for the local affiliate and or the community partner to connect with local refugee and former refugee community members and community groups and community organizations to work collaboratively to make sure that a client doesn't feel isolated or has access to culturally appropriate food and culturally appropriate worship, things like that. So that's certainly part of the whole process and maybe the mapping of the community and community resources. So I hope that is helpful. I hope I sort of answered some of that question. But if anyone else wants to talk about that, maybe how you all work to collaborate or connect with refugee community members and community organizations to work collaboratively with you as an organization or with your community sponsor groups.
I mean, I guess I can speak to that a little bit. We've been part of the Wider Welcome Initiative as well, which is reaching out to, not just your white middle class, middle-aged people to be your volunteers, but kind of going beyond that. And it's an initiative that we are still in the middle of, but who can we reach out to that, I mean, we've been looking at schools. We have reached out to like some different Muslim groups in the area just to kind of start to engage more. But I would say that we are not where we want to be with regard to that, but we have an awareness of who our typical volunteer base is now, and we want to expand and grow that so that we do have a broader base and more people connected in the community that have, similar backgrounds and histories and can relate to our clients coming in and be another advocate and network for them as they, kind of adjust to life here in Kansas City.
Yeah, that's great. I'll go ahead because I want to get as many questions in as possible, if that's okay. So one is, how do you encourage and explain to volunteers the importance of cultural integration, not just assimilation, and having appropriate boundaries, maybe between co-sponsor groups and a refugee client and or with with affiliate staff?
Well, there are a couple of points embedded within the IRIS training that definitely hammer home the importance of both of those things you just mentioned. I think I mentioned earlier that throughout the training, it's emphasized that everything a co-sponsor group does with a family should be with keeping in mind it's the family's independence and self-sufficiency that is the ultimate goal. And there's lots of ways to make sure that happens. And, things as basic as, does a family really need to have a ride for this particular location they need to arrive at, or is the public transportation sufficient? And, if a family needs help with that public transportation, what volunteers prepared to ride the bus with them and make sure it happens. And there are 1,000 different examples like that. And within IRIS's training, they go over a lot of examples that emphasize that point for sure.
That's great. And looking at some other comments and the questions, someone was also having some technical difficulties with hearing, but it looks like they got it fixed and it was on their end. I'm sorry for that, but everyone will get a video, which should hopefully have the audio all the way through. So hopefully that won't be a problem. Another question is curious to hear if or how a cultural orientation has been affected by community sponsorship. Anyone have thoughts on that? Yeah, I mean, it's an interesting question. I'm not sure, in what ways maybe that, I guess, the question maybe is, do you see any difference in the level of kind of scores on the cultural orientation assessments that appear to be higher, perhaps with clients who have co-sponsored groups versus just staff helping, or do you see any other sort of, I don't know, things that have gotten better, or systems that have gotten better because of the incorporation of community sponsorship when it comes to cultural orientation?
I think there's definitely more of a chance with co-sponsorship to reiterate some of the cultural orientation and revisit, because you're with them, co-sponsors maybe with the family and more frequently than case managers. So I think there's more room for conversation. There's more room to revisit ideas and ask questions. So I don't have any data, but I think that it probably lends itself to, more conversation about the topic.
Yeah, I would agree with that. I don't have data either. That was my thought. But we talk about cultural orientation as a philosophy here, and talk about that with our groups as well. So any opportunity they have to reinforce that, I can only imagine it's just so helpful for the families and the individuals.
That's great. Just one more here before we end. Someone was asking if IRIS does trainings outside of Connecticut. I'll let you all answer that, but I will sort of just do a quick plug for the Refugee Welcome Collective and our baseline training that we're working on. It was done in cooperation with IRIS and with other national resettlement agencies, so that community groups across the country will have access to this training. But Barb or Cindy, I'll leave that to you too, just in case you all provide additional training to people outside of Connecticut.
Well, so our training has been limited at this point to Connecticut groups. It has been opened up since the Afghan crisis to groups that are forming in Westchester County, New York. And the reason for that is, if they're going to be working with IRIS, there has to be a geographic area where IRIS case managers can actually get to them. So they can be, represented by that official affiliate representative. But I haven't heard any discussion, Cindy, maybe you have, about opening up training to other groups, but it sounds like the work that RWC is doing would cover that.
I haven't heard about any us opening up training to other people.
Yeah, I just want to say thank you all so much. It's coming to the end of the hour. I want to thank everyone for attending, and for our presenters today, Sarah Colstow, Barbara, and Cindy. You all are extremely knowledgeable, and we really appreciate you presenting today. Thank you everyone for attending today's RWC Lunch and Learn. If you have any questions, you can contact me directly for right now, if you'd like, at dfeldman@cwsglobal.org. Once you leave today's webinar, you will receive a follow-up email with a link to view a recording of today's webinar, as well as descriptions of more upcoming RWC Lunch and Learns. On behalf of Refugee Welcome Collective, thank you for joining us, and have a great rest of your day.
Thank you
For having us.
Sorry again about my camera.